Well, hello everyone. My name is Scott Yaruss. I am here on the line with Nina Reeves. I see many people have joined us for our office hours meeting this morning. I want to thank you for doing that. And we're just setting up the screen on this side, getting everything ready. We're up to about half the participants that we'll have today so far. So I'm going to talk just a little bit as we get people ready. Thank you all for joining us. We know that these are extraordinary times in the entire world, and we are thrilled to have participants from not only the United States, but also several other countries. So thank you very much for joining us. It's a nice thing for us. We're from Stutter Therapy Resources. This is a small publishing company that Nina and I started several years ago now to develop resources for stuttering therapy. What we do is we write down the things that we do in therapy. We turn them into books and handouts and resources and other materials designed to help speech language pathologists help people who stutter. That's our mission, that's our goal, and that's what we're hoping to do here today. Today's meeting is going to be a bit informal. We're going to start off with the first half, talking a bit about helping young children who stutter, and then we'll do some question and answer. We'll take questions from the audience that are here. We are recording this session, so if you're not comfortable being recorded, you might want to exit the meeting. All that will be on the recording is the slide and the images of Nina and me, but if you ask a question later on, then your image might appear. So just be aware of that. We will be posting the replay on YouTube. You can follow our YouTube channel. It is at Stuttering Therapy Res. Stuttering Therapy Resources is too long for YouTube, so Stuttering Therapy Res. And we will ask you also, please not to record the session yourself. Since we're making it available, we would appreciate for copyright purposes if you let us do the recording, and we'll post that for everyone. We also are going to be posting future resources. We're going to be doing a lot more handouts, blog posts, videos, more of these office hour things. You can connect with us on those on our Facebook and our Instagram. There we can fit in the entire Stuttering Therapy Resources name. Twitter, again, just short, Stutter Resource, because it's Twitter. You only get a few characters anyway. So if you are not already following us, please do that. And please, in particular, if you are on Instagram, we're trying very hard to build our Instagram following there. It's a new platform for us, and we will be grateful if you tag your friends, encourage them to follow us on Instagram. We're going to start posting some things that only show up on one service or only show up on the other service in an attempt to increase our outreach to those various services. So what I'm going to do right now is I'm going to stop talking and I'm going to turn the floor over to Nina Reeves. She'll do a brief introduction of herself, and she's going to talk about what we can do to help our young children who stutter and their families right away, because everybody's feeling urgent in these days for good reason. We're going to talk about what we can do right now to help. Nina, it's all yours.
Thanks, Scott. Welcome, everyone. I am Nina Reeves. In case you don't know me, I am a board-certified specialist in fluency disorders like Scott, and we have been pairing up for many years now, trying to, as Scott said, bring you those resources. The cool thing about today is that even though it's predicated around the idea of how can we help right now in this very different time that we're all facing, none of the things that we're going to tell you are actually just for this time. We're going to continually stay with the evidence-based practice and knowing what we can do to help families and kids who stutter, but just maybe frame it in a way that how are we going to do that across the miles and across the screens? So my part of today's beginning is to talk to you about supporting the parents. And it's a very interesting time for supporting parents, especially those who are in shelter at home situations. They're facing a lot of very big changes in their world. they're not going to work, they are home all day with their children, they're trying to do schooling at home possibly, and these are all very big challenges for parents. So on this slide, you're going to see me have a few tips. I'm going to go ahead and turn off the slide for the screen share so that you can see us in a bigger way. But I wanted to just review what we're going to be talking about. First of all, we're going to talk about connecting with parents and how to do that in the virtual world. Finding out what they need from us right now, because what happens is many times, no matter what the situation is, what we think parents need and what they actually need may be two different things. So I'm going to talk a little bit about that. Helping them, parents of young children who stutter may be sensing some panic in any time when they're watching their child who was maybe speaking more fluently now starting to struggle. That sense of panic is real, and so I'll give you a few tips of walking through the panic and helping them understand stuttering and stuttering therapy without overwhelming them. That's one of the things I struggle with a lot because I have so much information and I have so many things that I think will be helpful to parents that I have to remind myself not to overwhelm. And then, of course, creating that supportive communication environment, because that's one of the most important things that parents can do for their children for their young children who are experiencing some stuttering. So let me start with connecting with parents. I had a conversation with a colleague, and it's going to show up in a blog probably by next week, who said something to me that rang a bell in my head. She used the term parental capacity. And it really opened my eyes to the idea that in this time, right now, the capacity for parents to take on a lot of new things may or may not be available. Some parents may have more time to do that right now. Other parents, and many parents, may have less. So trying to connect with parents in a way that is helpful and effective, but not overwhelming, shows our support for them during this time and letting them know that we're here and we're going to help them and their children who are experiencing some stuttering. But that connection has to be a two-way street, and we have to figure out in this new reality how to do that effectively. I'm gonna sort of fold in some ideas as I talk to you about discovering what they need right now. Um, it's always an interesting time when we're getting to know a new family in a therapeutic relationship, and it's important to discover those differences in the family culture, in the family dynamic. Every family handles communication differently. And so we want to really connect with those parents by asking them, what is it that you feel I can be most helpful with right now? What are the things you need from me, and how can I be of assistance? By asking those types of questions, we can start to glean information that helps us target exactly what the parents need, and then we can mold and start to add in some of the other aspects of learning about stuttering in a way that helps them acquire the information easily. Okay, and so as we're doing that, as we're connecting with the parents and then finding out what they need from us, we may need to be helping them walk through the panic. And I use that terminology in a way that helps us know this is a process. Nothing that we're just going to say one time or hand them a pamphlet is going to be long lasting. It's going to need to be that relationship with us that lets them know they don't need to panic. Their child is going to be okay. Whatever okay looks like, we don't know. We don't have that crystal ball. but we want them to feel the understanding that panicking creates reactions, and reactions are not usually a good thing when we react to things. So what we're trying to do is allow them to hear from us that steady, stable voice of support, so that they can learn to then respond to what's going on in their child's speech rather than react to it. And they can have that feel of, I've got this, through the relationship with us and through our support and through their increased learning. They can feel more empowered to not feel that panic and to know that this too shall change. The changes in stuttering are part of the disorder, and it's not that the parent needs to be on the roller coaster. We want to help them be the parent who stands steadily while their child's speech changes from day to day, even minute to minute, and knows in their heart that they're going to all get through this. Okay, and so on my fourth point, as we start to help parents understand stuttering, we have to be very cognizant of the fact that stuttering is one of the many misunderstood disorders in the world, and that in the day and age of internet and social media, myths can outweigh facts, and myths are easy to get. That's the problem that a lot of us as professionals face, is that it's easy for parents of young children who stutter to find bad information, inaccurate, old, and flat out just not true. And so, depending upon what they've been trying to do to learn more about stuttering, where they've been looking, we need to be that voice, as I said before, that steady, stable voice of factual information, to understand that they may have heard some inaccuracies, and to help them reframe those with a steady stream of factual information. Again, this all ties back, if you think about it, knowledge is power, and it's much more comfortable to not react when you have knowledge. It's much more likely that a parent will feel calmer and more enabled to deal with what's going on with their child's stuttering when they have facts, and when they're not chasing the bright, shiny thing that is going to give them the next quick fix or promised cure. And so, as we help parents understand the facts about stuttering, we can help the child indirectly and directly to have what my fifth point is, that supportive communication environment. So as we help parents feel connected, as we find out what they need and begin to supply that for them and help them learn how to supply it for themselves, then we can be a very large part of creating that supportive communication environment for that child. What I mean by supportive communication environment is multifaceted, but for brevity's sake, because we don't have tons of time today, I just want to make a few points about what that means. And then Scott is going to tag right onto that when he starts talking about helping the child, because parents and communication environments and attitudes are a big part of how we help the children. So understanding that self-esteem can be very much framed by how parents handle things. A child's self-esteem is impacted by their parents, and we all know that. And so when when parents handle challenges in a way that help a child know that they're okay exactly the way they are, that helps to build a solid self-esteem for that child going forward. And if these young children continue to stutter, then they are going into that um, those older years with a self-esteem and a knowledge within themselves that they are okay just the way they are, whether or not they're stuttering more, less, a lot, a little, and they can feel much more capable of learning to handle life and navigate life with a stutter. And so that supportive communication environment, the advice that we give parents um, can be boiled down in many ways to find ways, mom and dad, by what you to check in with yourself and make certain that you are demonstrating by what you say and what you do in response to your child's communication that you're listening to what they're saying, not how they're saying it. That the message of what your child is telling you is much more important than whether they had smooth speech or bumpy speech or, a stutter or not. And that creates that safe haven in a home that may be one of the only places a child has in society where acceptance of stuttering is inferred and demonstrated, and it's just okay to stutter. And that goes a long way. And remember, we're talking about acceptance of what's going on right now and what may be going on in the future. And that doesn't mean we're giving up on helping the child, right? Acceptance of stuttering is a mindset and an atmosphere that allows kids who stutter to thrive no matter how they're talking. So that's my little summary of how we can be supporting parents during this time. And I'd like to turn it over to Scott, who can take us through how to support the children themselves.
Excellent. Thank you, Nina. You've hit on what I think is the most important message that we can ever convey to children, and that is that they are okay. And that's where I want to pick up. In fact, Nina, if you don't mind popping my slides up there,
Yep,
and I just
it's
have
slow.
to, there we go, that worked.
Yep.
And on to the next one, and beautiful. So look where I started. I started exactly where Nina left off for us as most important message, you're okay. We always say this. We always want kids to know that they're okay. But right now, there's a lot of uncertainty in every home around the entire world, practically, as people are trying to figure out how to respond to the current situation. And it's not surprising if the child sees mom and dad being a little bit nervous. They are nervous. What happens from that, though, for the child is the child picks up on the emotional valence of the environment. The child picks up on the fact that mom and dad are worried, or mom and dad may be bickering more than normal, or mom and dad may be struggling with whose turn it is to use the computer, or mom and dad are handling this great, but he can't see his friends and he can't go on a play date and he can't do all the things that he's accustomed to doing. And so we might help the children down this path toward ultimate acceptance right now, immediately, by reminding the parents to reassure their kids. This can be language as simple as, yes, I know it's a crazy time right now. Everybody is doing the best that they can, and we are doing the best that we can. And it might be a little bumpy right now, and that's okay because in life we experience bumps sometimes, and those bumps are normal. Those bumps are okay when they happen. It's not easy, it's sometimes very hard. And in saying all of this, I don't want to diminish the fact that some children and some families are truly experiencing very difficult times. One of my clients the other day, not of a preschooler, but of a school age child, I asked how things were going, and I learned that indeed his father's been very, very ill for 2.5 weeks with the virus. One of my adult clients, I haven't seen her in a few weeks, so I emailed her to see how she's doing. Well, indeed, her husband has been sick for weeks, and that affects the children as well. So starting off, remembering the importance of self-esteem, like Nina mentioned, and letting the kids know, yeah, it's hard right now, but we're okay. And as Nina mentioned, the child may be experiencing some fluctuations in their stuttering as they're maybe getting less typical sleep patterns, as eating patterns are different if families aren't going out to the market to get the food that they're accustomed to. All sorts of things like that can cause the child to feel uncertainty. So we can zero in on helping him know not only is he okay, but yeah, if he experiences more stuttering right now, that's okay too. In one of the videos that you'll find on our website, I talk about the bucket analogy that we use in our early childhood stuttering therapy book. The point of the bucket analogy is to say that sometimes our resources are limited. We have a bucket that we carry around with us in our life, and if our bucket gets too full of water, well, then the water is going to spill out, and that represents our thing, whatever it is, our fears, our anxieties, our tempers, our stuttering, our whatever our issue is. And lots of people right now are probably feeling like their buckets are pretty full. It's those resources that Nina was talking about. And so it's not surprising if kids have their bucket overflowing, parents can let them know this is just what we're going through right now. It doesn't mean that we'll always be going through this. This is what we're going through right now. And together, we're going to be okay. But now let's get a little bit more specific about how we can support the children with the parents' reactions. Nina talked about how we want to help be steady for the parents so that they can provide appropriate reactions to the child so that they are steady. Well, let's think about what an appropriate reaction is. Nina, if you don't mind at this point, you can go ahead and, um, um, whoops, there we go. Yeah, no, I think it's me. Thank you. We can talk about what an appropriate reaction is. What an appropriate reaction to stuttering is exactly as Nina said, keeping your mind on what's important. That is, when the child opens his mouth to talk, he is not doing it in order to be fluent. He's not doing it in order to use easy talking or whatever. He's doing it in order to communicate. And so we want the parents to keep their reactions on the child's communication, not on the fluency. So Nina highlighted that and covered that beautifully already. But what if the child is concerned about his stuttering? What if the child says, I'm having trouble talking right now. I can't say this. You say it for me. What's wrong with me? Children will do this. Even very young children will do this. And in those moments, it can be helpful for the parents to provide reassurance in the same way that they do for other difficulties that the child might face. Let's think about a child of about 3 years old, and he is learning many new skills, coloring inside the lines, drinking from a big cup, all sorts of things that are going on in the child's life at this point that require a level of coordination, that require a level of maturation and development. And when he's learning to do those things, the child is likely to make mistakes. That's normal for kids. They make mistakes when coloring, they go outside the lines. They spill their milk. As they're learning to draw letters and numbers, they might get them backwards when they get a little older. When they're riding their tricycles, they fall down. When they're running, they trip. All of this is normal. And likewise for these children, children who stutter, when they stutter in their speech, that is normal for them. True, it may not be normal for some other child, but for this child, that's the way their brain is developing. And so we want to respond to these normal disruptions for that child in the same way that we would respond to other normal disruptions. Well, what does a parent do? Child colors a picture, colors outside the lines, and let's say the child is not feeling very confident that day, not feeling very secure. Brings the picture over to mommy and says, look, mommy, I colored you a picture, but I colored outside the lines here. Well, the mom at that point doesn't ignore it for fear that the child's going to develop a coloring phobia. The mom doesn't say, oh, yes, that's terrible. You colored outside the lines, because she knows that it's okay to color outside the lines. We want her to have that same knowledge, that same acceptance. about when he talks outside the lines, stutters, when he trips while talking, just like when he trips while walking, that it's just part of development. And if parents can know this, then they can learn to respond to stuttering in the same way that they respond to other difficulties that a child has. How do they respond? Well, one of the things is that they acknowledge the problem. They don't ignore it. They don't pretend that it's not there. They acknowledge it. Oh, yeah, you colored outside the lines there a little bit. They do it in a nonchalant, accepting manner. That's okay. It's part of coloring. But I really like the picture that you made. So, in other words, they acknowledge it and they normalize it. And then they also just keep focused on the thing that the child was able to do. They don't go into a detailed analysis of the child's coloring patterns. They say, oh, it's a beautiful picture. Thank you for coloring me a picture. You know, acknowledge it, let the child know he's okay, and refocus his attention on the task at hand. Likewise, he is learning to ride his tricycle, okay, and he's going to fall sometimes. It's normal. Well, in that moment, the parents don't scold the child for falling on his tricycle. They don't look the other way so they don't have to acknowledge it. They go over, they scoop him up, they dust him off. They say, oh, yeah, you know what? You fell down that time, but look at how far you rode that time. You can do this. Yeah. Everybody falls while they're learning to ride, but you're going to be able to do it. Well, it's okay then to use those same patterns in helping children reduce their fears or prevent their fears about stuttering. If the child says to the parent, I can't say it, there's something wrong, what happened? What's wrong with me? The parents can respond the same way. Oh, sometimes when kids are learning to talk, they have a little trouble getting their words out. It's okay. It's just part of learning. But I'm really glad that you told me that. I found that interesting. And when you do this, you know what the kids say? They say, oh, okay. And they go about their business because now we've refocused them on what they were trying to do. They were trying to share a thought. And so they learn that, oh, yeah, the stutter itself, that disruption, that stuck feeling, that doesn't have to get in the way of me saying what I want to say. And that helps to reduce their fears. Again, sometimes when kids are learning to talk, they may have a little trouble getting their words out. That's okay. That's just part of learning for you. Notice we're not telling the kid anything that's not true. For this child, it's just part of his learning to talk. But I'm really glad you told me that anyway. That conveys to the child that we have nothing to fear. That's a bit about what the parents can do to create those environments that Nina was talking about that teach the child a different way of approaching these uncertainties that he's feeling, this stuck feeling. Because we have to acknowledge that even for a very young child, that stuck feeling is not a comfortable one. You know? And when he learns that this is not something he has to fear, that this is not something that he has to feel bad about, that this is not something that he's done wrong, that helps to reduce that growing fear that characterizes older kids and adolescents and adults who stutter. But let's also think about what the children can do themselves. Because very often, if you're able to be doing therapy with the child right now at all, there may be a desire to use this time to focus in on some therapy with the child. Well, this is a challenge because when we get eager to address the stuttering, often clinicians want to jump right in with techniques. And I get that, understandable. We know that when children use speaking techniques that it makes it easier for them. We know all that. That's great. But the problem is the child is still very young. He's 3, he's 4, maybe 5. We're talking about the little ones right now. And the little ones aren't necessarily ready to be jumping into technique, but there is something that you can do. And that is you can focus on preparing a strong foundation for the child for later focus on techniques. So bopping back to the slide here, we can see we've already been talking openly and honestly, and now we're talking about that foundation for future work on strategies. That foundation can be something as straightforward and critically important as what parts of the body do we use when we talk? And even little 3-year-olds can understand that to talk, we move our mouths. To talk, something happens here in our voice box. Ah, you can feel the vibration. To talk, we need air from our lungs. Even little ones can learn this foundational knowledge that they will need later when the time comes, if the time comes for them to address technique. Even little ones can learn about um, ability and how we can do things more sometimes and less other times. You saw on the slide there, and if you know our materials, you're familiar with helping the kids learn what too much of something means and what too little of something means and what it means to go somewhere in the middle. You don't have to start this with speech. In fact, I never started with speech. I started with something not related to speech, like this. When a child of age 3 is running, okay, he learns that he can run pretty much as fast as he wants, but if he tries to run too fast, he's likely to fall down. So when a child is running, he balances how fast he runs. Not too fast, because he'll fall down. But if he's in a race, he doesn't want to run too slowly because he won't win the race. He finds a place to run that's not too fast and not too slow, but somewhere in the middle. Yeah. Likewise, let's say he's playing with some race cars, okay, little matchbox cars or Hot Wheels, and he's pushing his Hot Wheels and having a race. If he pushes them too fast, well, I know you've played with them too. They roll end over end, right? But again, if you push them too slowly, you won't win the race. So you try to go just right, somewhere in the middle, not too fast and not too slow. Well, we can play these games with children, non speech games that help them learn that when we're doing something and we're thinking about how fast to do it, we don't try to go too fast because that makes it harder. We don't try to go too slowly because that makes it harder. We try to go somewhere in the middle. You can tell that that's going to lead us later on to some speech changes in which we might be helping him be aware of his pace of communication. And if his pace is higher, it might be harder for him to say what he wants to say. He goes for a pace that's somewhere in the middle, that's comfortable. We can do that with the timing of movement. We can do that with the tension in movement. If I'm trying to walk and my muscles are too tight, it's harder to walk. But if I try to walk and my muscles are too loose, it's harder to walk. I use the right amount of tension, a middle amount of tension. You can see how that's going to apply to speech too. When we try to talk with too much tension, it's harder to say what we want to say. When we try to talk with too little tension, we can't say what we want to say. We're looking for in the middle. These are critical foundational lessons. And if you are familiar with the story of Goldilocks, which I know many of you are, you can share that with the kids. They probably already know it so that they understand the difference between too much, too little. And in the book, it's just right. I say just right sometimes. I see somewhere in the middle. This is critically important speech therapy that the child needs to have for his future work on technique if needed. So, most important, creating that supportive environment, helping the child develop those healthy, appropriate communication attitudes. And then, if you are going to be moving towards some strategies, first, always remember lay a strong foundation. And as you build that foundation, help the child learn about how he talks, help him learn about timing and tension, and start off with non speech analogies. There is no rush to jump into speech. Speech is a very abstract concept for the kids. Start off playing with things he can hold on to, the toys that he's already playing with. If you're doing this remotely, as we all are right now, he's got Hot Wheels cars or Matchbox cars or a truck of some sort that he's playing with or anything that he's playing with. You can do the same on your end and you can share that over the video. Obviously, much, much more to say, but this is just a start. Let us now move on to, um, oh, the next slide. if that's okay. Oh, you know what? Before you do that, Nina, I want to share a slide too. I want to share this. When we're talking about helping children develop healthy attitudes, you will find on our website from Stuttering Therapy Resources a handout specifically for helping kids develop healthy, appropriate communication attitudes. Comes directly from our early childhood stuttering therapy book. So I encourage you to go take a look at that. Okay. So Nina, if you want, yep, there we go. Excellent. We're going to be doing this again. Pardon me. Starting next week. Well, continuing next week, next Friday, same time. We'll be doing these just for people who follow us on Instagram, just for those who follow us on Facebook. The one next week is for our email community. We've already got an email queued up so that if you are on our mailing list, you'll be getting the link for next week's meeting. If you're not on our mailing list, please join us. Just go to our website, stutteringtherapyresources.com. Now, what we're going to do now is we're going to bring this portion of the program to a close,
Mhm.
and then we are going to focus on taking some questions. So, Nina, if you would go ahead and give us the next slide.
Yes, sir.
I don't have the ability to control
That's all
that.
right.
I
We
don't
got
think.
it.
Maybe I do. I don't know.
We're just thanking
Yes.
everyone that may be dropping off, and that we want to let them know how much, we appreciate you all for joining us live. If you're watching us on a replay on YouTube, thank you for taking the time to learn more about how to navigate parental support and child therapy in the early intervention atmosphere. And so if you have any questions, please feel free to always email us at info@stutteringtherapyresources.com. And we appreciate you being here.